I'm speaking with Dr. Dietrich Stephan, the past executive director of the Gene Partnership at Children's Hospital Boston and also the co-founder of Navigenics. Dr. Stephan, Navigenics and the Children's Hospital of Boston are two organizations that have made a concerted effort in providing genetic testing for pre-symptomatic individuals in order to truly personalize care. Can you speak about what it takes to get a program like this off the ground and running smoothly, and maybe discuss some of the obstacles and challenges that you faced?
So over the last decade, recognizing that all human disease has a genetic component, yet that we haven't been using that in clinical care to better manage patients, we've really built out several pieces of infrastructure nationally and globally to enable the medical community to improve outcomes for individuals by leveraging that genetic information, and at the same time by reducing costs so that that information can be garnered in an affordable way and that they actually save healthcare dollars. So to specifically answer your question, Navigenics was started in 2006. We raised an enormous amount of money from the venture capital community in Silicon Valley, south of San Francisco, and set about to methodically pave the way to really be able to deliver the genome in a clinically rigorous fashion, meaning CLIA, FDA approved way, so that it could really be used in the clinical setting. And in a scalable way, meaning that with one central laboratory location, we could really be able to have a global reach with our testing product. So that was a monumental effort. It continues today, and we're seeing some very nice pilot data showing behavior change and clinical efficacy coming out of that program. We started it, it was one of the first initiatives started. It was in early days, and it's finally becoming mainstream now. An indication that Navigenics is becoming mainstream is that the Children's Hospital of Boston, the #1 pediatric provider institution in the nation, has fully embraced genomic medicine based on what we did at Navigenics, and asked me to come in and help build the business and sustainability model to activate that program hospital-wide. Now, you know, there's a lot of rhetoric around disruptive innovation in healthcare and how that's really one of the true vehicles to get change affected to benefit patients in an abbreviated time frame. And I have to say the Children's Hospital of Boston folks really wanted to drive change from within and pave the way towards improving outcomes in their pediatric population through the use of the genome. Now that project also empowers research, so it's a learning environment primarily, but the patients will eventually benefit from that initiative.